In this video, we speak about the common do's and don'ts you must keep in mind while preparing an SIR. Let's start by listing the do's. 1. Keep the child at the center and respect the child's voice. Adopt a child friendly approach and try to understand the child as a unique individual who has rights. Assess the child's circumstances, needs, vulnerabilities, and consider their views in your recommendations to the CWC.
2. Apply the fundamental principles. Refresh your understanding of the fundamental principles listed in Section 3 of the JJ Act and apply them diligently.
3. Incorporate best interests. Remember the 7 elements that must be considered while assessing the child's best interest. This should guide every step of the process.
4. Plan the logistics of your visit. Carry your ID, order of the CWC directing you to prepare the SIR, ensure your phone is charged, plan your transport options, especially in remote areas, and inform a colleague about your location.
5. Connect before you collect. Develop rapport and trust with the child and family. Explain things in a way they can understand so that they can share their views freely without fear. Ensure that the child's views are heard and recorded accurately. Use a warm, respectful, professional, and conversational approach that helps build trust.
6. Protect sensitive information about the child. Be careful when explaining the purpose of your visit to the family, neighbors, school, and others you may interact with. What you say may impact the child's dignity, relationships, and their future too. Only share relevant information with relevant persons and avoid unnecessary disclosure of sensitive details.
7. Listen with your eyes and ears. Actively listen and avoid interrupting. Ask clear, open ended questions in simple language. Take the assistance of an interpreter or translator if required. Make eye contact and demonstrate your concern for the child. Children and families may not always express their needs directly, especially if they feel unsafe, embarrassed, or unheard. Observe body language, hesitation, or behavioral changes. Ask sensitively framed, pointed questions and seek insights from caregivers and teachers when you sense that there are underlying needs or fears that are not being articulated.
8. Assess risks and strengths. Identify risks and strengths concerning the child, which can be psychological, social, health, educational, financial, and other aspects of the child's life, and also the child's environment, such as family dynamics, extended family, school, and so on. Take adequate precautions and assistance while doing visits in sensitive cases and in conflict areas.
9. Be culturally and socially sensitive. Understand the identity of the child and the child's family, taking into account socioeconomic status, religion, caste, disability, if any. Dress appropriately and respect cultural norms. Demonstrate respect for the child's identity, background, and lived realities while remaining conscious of any prejudice you may have.
10. Document diligently. Note important details, use verbatim quotes where relevant, separate facts from observations and opinions, and triangulate information from different sources. This means cross-checking and verifying information, confirming with multiple sources, and reviewing all information for accuracy.
11. Give clear, actionable recommendations. Your recommendations should be specific, realistic, and tailored to the child's needs and best interests. Most importantly, you must make suggestions for how the CWC can ensure the child's right to care, protection, treatment, development, rehabilitation, and social reintegration as envisaged in the preamble of the JJ Act.
12. Professionalism. Demonstrate a professional approach and positive, respectful attitude towards children and families. Apply your knowledge of human behavior, the child protection system, and community resources. You may as well use your skills in preparing high quality SIRs that will help children and families address challenges and improve their well being.
Here's a list of things you must not do while preparing an SIR. 1. Don't prepare SIRs mechanically. A well documented SIR should provide detailed descriptions about the child, their circumstances, needs, vulnerabilities, family relationships, and emotional health, along with recommendations focused on the child's individual needs and best interests. Avoid merely ticking check boxes. Use additional sheets where required.
2. Don't make assumptions. Don't make assumptions about the child, their family, or their circumstances based on your personal beliefs, stereotypes, or past experiences. Avoid making remarks or blaming the child or family for their situation. Every child's situation is unique, and your role is to understand their reality with empathy and objectivity.
3. Don't investigate beyond your role. The SIR is not meant for collecting evidence regarding any offense against the child. The focus must remain on the child and the child's circumstances.
4. Don't take signatures. The SIR is meant to document observations and assessments, not to collect formal statements. Asking the child, family, or others for signatures may create fear or hesitation, making them less willing to share openly.
5. Don't make vague recommendations. Avoid general statements like the child should be given support. Instead, specify the type of support needed. For example, education, sponsorship, counseling, family reunification, while giving concrete information that would enable specific orders for each recommendation for both short term and long term care planning.
6. Don't hesitate to seek guidance or assistance. Consult experienced colleagues when unsure about any aspect of the case while writing your report. Take pride in being a lifelong learner, aiming to be an expert in this important role. Remember, you can change the course of a child's life forever